So from a perspective of how we use this history form, we're meant to use this to influence our thoughts and our attitudes in the physical exam, I think.
Yeah, right.
Where was your head in entering into or anticipating the physical exam?
Okay, so I never try to anticipate or guess anything because I always guess wrong. And what I tell the diploma residents when they come is just don't want it to be anything. Just let it be what it is. Because as soon as you want it to be something, now you're introducing confirmation bias.
Mm-hmm.
If you're ruling things out, which we really should be doing with the history, we ask these questions for a very specific reason, for a very specific intent. And every question we ask should have an intent.
Mm-hmm.
And if it doesn't have an intent, we probably shouldn't ask it.
Mm-hmm.
So we're ruling things out, and that only leaves a couple of things. So right now, from a mechanical standpoint, the thing that's left really is a derangement.
Mm-hmm.
So, that's where our head can be going, but not to the exclusion of everything else.
Yeah. Todd, some of us remember instruction in our courses that we can look to the history to anticipate how aggressive we might need to be with loading, mm-hmm. or how careful we might need to be, whether mm-hmm. we need to consider doing repeated movements or sustain in-range positions based on their presentation or based on their history and how they describe it. Did you get any type of strong conviction one way or the other from the history that you would need to be aggressive or really might need to take quite a few reps, or that you're going to have to be careful not to flare her and not be able to bring it back down either way?
Right. It's been getting worse over the last 3 months, but this is a really young, healthy person who she's had difficulty running, but she's still running.
Yeah.
So in terms of aggressiveness, I don't know that yet until she starts moving around. But what I'm thinking is she's a burn surgeon. She works 8 or 9 hours a day in a burn unit. She's lifting people. She's a little bitty thing, right? She's as big as a minute, but really she's very powerful.
Yeah.
So I'm not thinking that she's going to break if she bends forward once, or she's going to need a spinectomy. What I'm thinking is we need to move her to see what exactly is going on. So we shouldn't be afraid to move people. And the evaluation form it's really quite nice because it's all laid out for us.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.